Hello, how you doing? This is Dr. Keith Henry, the vegan naturopath. Hope you're having a good day today. Our topic for today is, or our article for today, we have an article from Mercola.com. And it's entitled "The Link Between Birth Control Pills and Depression." And in our very quick health nugget, news nugget today, we'll look at the story at a glance over here to your right. Basically, women who use hormonal birth control had a 40% increased risk of developing depression after 6 months compared to women who did not. The risk of developing depression after hormonal contraception use was greatest among adolescents, and the use of hormonal birth control was also associated with subsequent use of antidepressant drugs. So here we have basically what Dr. Mercola is pointing out in this article in a nutshell is that those women who use birth control have a greater or higher risk of depression. So if you are a woman who are using birth control, or you are the mother or friend or whatever of someone who is using birth control, you might want to make make this known to them. Here, at the top you can see here it says birth control pills are the most popular form of contraception among U.S. women. They're taken by about 16% of this population, while just over 7% use the long-acting reversible forms of contraception such as hormonal intravenous device or implant. He goes on to say that what these pills, devices, and implants have in common is that they're forms of hormonal birth control. That is, he says, they contain or release synthetic forms of hormones such as estrogen and progestin, which is a form of progesterone, which work to prevent pregnancy in various ways. So let me just add here right off the top that your hormones, balancing hormones, is very, very important. And when you begin to go in and take drugs that can affect the hormones, especially synthetic forms of hormones, you actually it's almost impossible with that to really not have some type of negative side effects. He goes on to say in this article that the problem is that these sex hormones also affect mood and other biological processes, and artificially manipulating them can lead to many unintended consequences. And that was my point precisely. And he says these unintended consequences of these taking these hormones can lead to unintended consequences in your body, some of them uncomfortable and some quite serious, including altering your mental health. Mercola goes on to point out that researchers from the University of Copenhagen in Denmark analyzed data from more than 1 million women over a period of 14 years. None of the women who were between 15 and 34 years of age had been diagnosed with depression at the start of the study. But he says, based upon the analysis from the study, the women who used hormonal birth control had a 40% increased risk of developing depression after 6 months compared to women who did not. He says the risk was greatest among adolescents. He goes on to say that the use of hormonal birth control was also associated with subsequent use of antidepressant drugs. In other words, once they started using these birth control pills, subsequently many of them ended up having to go on to antidepressant medication. We'll scroll down here, and again, we're not going to go in detail of the whole article. This is the whole point. This is quick news nuggets just to bring these things to your attention. But we'll spend a little bit more time here. He goes on to say, he gives a case here. He says in one case, a 31-year-old woman experienced a gradual improvement of her depression symptoms after she stopped using the vaginal ring. However, a sudden and acute worsening occurred shortly after she started using a combined birth control pill. About a month later, she again experienced a worsening of symptoms almost simultaneously with the initiation of treatments with the combined contraceptive vaginal ring, the researchers noted in their research. So again, he's just given a couple of an example there, tying in the depression with the use of these birth control drugs. He goes on to say women who use oral contraceptives for longer than 3 years were more than twice as likely to have been diagnosed with glaucoma, which is a leading cause of vision loss and blindness, according to one study. He says further, the results were so striking that the researchers recommended women taking the pill for 3 or more years be screened for glaucoma and followed closely by an ophthalmologist. So not only is there a danger of taking these drugs, not only is there a danger of an increased risk rather by 40% of developing depression, but also now there's a danger if you stay on them for at least 3 years of developing glaucoma. Finally, near the end of his article here, he has a little chart here showing some of the side effects. He says here, according to one report by the U.S. Centers for Disease Control and Prevention, the CDC, 30% of women who have used the pill and nearly half of women using other hormonal contraception methods stopped their use due to dissatisfaction, which was most often caused rather by side effects. And then he lists some of the potential health risks for those women who may be taking these synthetic drugs. Goes on to say cancer is one, thinner bones, heart disease, fatal blood clots, impaired muscle gains, long-term sexual dysfunction, migraines, etc. I've even had cases where one young lady had been on birth control for a while, and when she got married and wanted to have children, she was trying to go back and they wanted to have children, and they contacted me because she hadn't had a period for 6 months after stopping the birth control pills. So there are all kinds of problems that can occur. This is the Vegan Naturopath, Dr. Keith. See you next time.